We will kick this off here and start this meeting. And so I will call the meeting to order and we'll start with roll call.
Ron Anthony. Julia Tella.
Here.
Kim Britt.
Here.
Amber Brown. Molly Bruner.
Here.
Becky Bales. Michelle Frisbee. Michelle. Try again, Michelle. It's showing you're unmuted.
Can you hear me now?
Yes, we can.
Okay, yeah, I was on my headset. There's another mute button. Sorry, I'm here.
No problem. Kevin Glass.
Here.
Tracy Green. Scott Helverson.
Here.
Nicholas Henderson. Jake McClellan.
Here.
Kelly Mitchell.
Here.
Kurt Mortensen is not here. Becca Muscat.
Here.
John Priam.
Here.
John Shiro is not here. Barb Weckman-Brecky.
Good morning. I am here. As I let Donald know, I'm here for a bit, then have to step away for a groundbreaking, and then I'll be back again.
We have quorum.
All right, thank you. All right, so we'll move on to approval of the April 23rd minutes and the agenda. Do we want to do both at the same time? Okay. And we'll also look for a motion to approve the current agenda. So I'll open it up either for discussion or a motion.
This is Tracy Green. I'll make a motion.
Thanks, Tracy. Do I have a second? Do you have a second?
Scott Howerson, I'll second.
Thanks, Scott. All right, then we'll do.
All right. Julia Tella.
Yay.
Kim Britt.
Aye.
Molly Bruner.
Aye.
Michelle Frisbee. Kevin Glass.
Aye.
Tracy Green.
Aye.
Scott Helverson.
Aye.
Jake McClellan.
Aye.
Kelly Mitchell.
Yes.
Becca Muscat.
Aye.
John Priam.
Aye.
Barb Weckman-Brecky.
Aye.
And it passes 11-0 with one abstention.
Okay. Thank you very much.
Is that the next one?
Yep, you got the next one.
All right, so next item on the agenda is, I have to find it. Next item on the agenda is a loss of CSG facilitation in the federal grant. So on the day of our last meeting, we had an inkling, but we didn't know for sure. And the official notice came through later that the federal funding that had supported the subaward that Minnesota received and the work that the Council of State Governments had been doing in Minnesota was canceled by the federal government. So CSG had to quickly end their work with us. They did give us a file transfer of all the materials that they had put together in working with us, especially on the justice reinvestment side of the project. So they did that. We have those materials, but we no longer will be able to work with them through the balance of this year. They were slated to work with us through about the end of September. So we were gonna have to sink or swim on our own pretty soon anyway. But we're pretty sad to lose their support, especially in such a abrupt manner. And we really, I really do want to say on the record that we really appreciate the work that the Council of State Governments did with CSAC. I think that had they not been here, we wouldn't have made as much progress as we did over the past year, really providing us a lot of a good direction and concrete steps for action on the numerous deliverables that we had. So first of all, I just want to give them put out in the airwaves a public thanks to CSG for all the work that they did. The second piece of that is we have to figure out now how we're moving forward. So in the interim, the co-chairs did meet and we talked about which work CSG was specifically facilitating and which work other groups had taken charge of. So as an example, when we look down our list of deliverables, you'll recall that you'll see that the Evidence-Based Practices Committee has been tasked with some of the work. The Domestic Violence Steering Committee has been tasked with some of the work. So those groups were never facilitated by CSG and they have been continuing their work. But there are a couple of groups that were specifically facilitated by CSG. So we wanted to talk about how to move that work forward and what that would look like. Those two groups are, one of them was the Justice Reinvestment Group. We called it JRI2 because they were the second phase of the Justice Reinvestment Initiative within Minnesota. So that group has representatives from all three delivery systems. It's pretty big and it has responsibility for several of our deliverables. The second one is, several deliverables, including things like the case planning policy. What's another example of JRI2? The risk needs response grid, right? Behavioral response grid, that sort of thing. The second group is the risk and needs group, and they were working on all things risk assessment oriented. So the policy for use of the LSCMI, trailer tools, that sort of thing, whether we would recommend or create a pre-screener within Minnesota. So those two groups are out there and don't have a rudder, if you might. We were going to have to create that rudder no matter what. But in discussing it, Molly, John, and I, really talked about the fact that CSAC will always have projects and work that we'd like to bring forward, that will need another group with subject matter experts to be part of, to help us get to the policy development, get to implementation. So we anticipate that we'll always need groups like that. Those may not be the groups that we always need. But for now, they do have specific responsibilities that we've asked them to do. So what we'd like to do is continue with JRI2, or what we're recommending is that we do continue with JRI2 and the risk needs group, and that we have each delivery system identify a member from those groups that could co-chair those two groups. That way, we'll have that sort of equal representation in continuing to develop the agendas and the work and guiding the work of those groups. So that's one one topic that we wanted to bring for your consideration today. So I'm going to let that percolate for a minute. Think about it. Think about whether you have questions on that. And then we can move to whether or not, then I'll ask if the rest of the committee agrees with that approach. The second piece that I was supposed to talk about first, and I took them in reverse order, was the grant itself. We had received a subaward from CSG as part of the Justice Reinvestment Initiative. And that subaward was supposed to help fund some of the work that we're doing. So I wanted to run through a quick update on where we are with those pieces as well. So one of the items that was supposed to be funded through the subaward was the LSCMI validation. That is being led by the University of Nebraska Omaha. There's a research team led by Professor Zachary Hamilton out of that institution, and they're working on the LSCMI validation. DOC is going to pick up the tab for that part of it. So we've already started the LSCMI validation work, or Professor Hamilton has started that work. It's not a huge price tag, so we're going to find it in our budget to make sure that that gets completed. And if for some reason DOC is running short on funds, I've already received several suggestions from people in the know about ways that we could talk with the vendor about paring that work back if it's necessary, but I don't think it's going to be necessary. I think we're going to be able to find those funds. The second bucket of work was for the case planning policy. There's sort of two things going on there. One was that we were going to be updating the case planning module in CSTS, which is the case management system that all of our probation and supervised release agents use across the state. So we wanted to update that module to bring it more in line with the practices that agents will be using, and to allow for some metrics to be developed to help us determine if case planning is indeed happening the way that we anticipate that it will under the policy that's also being developed by the JRI2 group. So that work had been underway. The DOC Field Services unit, so that's our probation agency within DOC, had been the one to sort of spearhead that work, or worked with the vendor to get it going. They found some funding, spend down funding for the rest of this biennium, and talked with the vendor about, how far could you get us by June 30th? So the vendor has come back with a proposal to get us, not all of the way to the Cadillac that we were hoping for, but to a pretty good, Ford. I don't know, pick your Ford. So we're gonna go ahead and pay for the development that can be done through June 30th, and it sounds like that will be. That will still put us in a pretty solid place with the case planning module. Along with that, the vendor was also going to be creating a calculator for the supervision abatement policy that's related to MRRA, the Minnesota Rehabilitation and Reinvestment Act. That was a smaller piece of development, and it sounds like the vendor will be able to complete that within the June 30th timeframe as well. So those pieces will get done and move forward. The third area that we had funding for was recidivism analysis. So this again is within the case planning module, or case management system, CSTS. There was a project proposed to link up the case management system with the courts, so that any of the agencies that use that system could pull recidivism data from the courts and sort of do a check on their populations. We do not have a funding source for that, So that is, I think, going back to the CSTS exec team to sort of figure out if they're going to be able to move forward with that project, lacking that funding. I'm not sure if you know any more about that piece of it.
I don't.
I don't either. I don't know if, Jake, are you on the CSTS exec team? Do you know anything about that?
I not off the top of my head, I was not at the last meeting due to the
Oh,
ISR
okay.
conference, so I apologize.
Okay, no problem. So the upside is we're gonna for sure get two of the three items that we had that funding for done. You know, I think we managed to squeeze $13,000 to $15,000 out of the grant before they shut it down. So we got something for our money. So that's the update on the loss of the federal grant. So any questions about any of that information that I just shared? All right. Then circling back to the two groups that are rudderless, the JRI2 group and the risk and needs assessment group. Is CSAC okay with the delivery systems identifying members from each system to help co-lead those groups? Does that sound like a good approach to everyone? Seeing a couple head nods.
You want to roll call it? Is that a decision that we're going to be? I didn't ask you before that.
I don't know.
Okay.
We can. So Molly's just asking if we should do a vote on that, and probably we should. So I guess if somebody would be willing, I'd entertain a motion to have each of those groups identify a lead from each delivery system to continue to manage the work until they've completed their deliverables.
This is Jake. Oh, go ahead, Julie. I'll let you have this one.
Right. I will make the motion then. Thanks, Jake.
Julia
Jake,
Kellum makes the motion.
and I will second that motion.
Could I maybe amend that
McKellen's
motion?
Seconds.
Um,
Go ahead, discussion, Kevin. Go ahead.
Thank you. So we have several CPO counties folks in those groups, and I would consider some of those experts in those fields. And so we would definitely want them on there. The issue may be some of those that work in those counties are now switching to a CCA county. And we've had some discussion on some of these where we know the changes are going to be taking place. And in some of those circumstances, as MACPO, we've been comfortable having those people stay on certain committees, even though they may no longer be a CPO county. And so I would say if we do appoint somebody representing a CPO county through MACPO, that the option that person can stay still representing CPO or MACPO as long as MACPO and CPO directors feel it's appropriate. Because I'll just say, like, so say we appoint someone and then October they change. We don't want to just keep replacing people that, even though that may be the best person, and we still represented, CPO still represented by that person, if I'm making sense.
No, it totally makes sense, Kevin. I appreciate it, and I support where you're at and the sentiment there. And I would want to bring it back to MACAC to have the discussion versus just to make a decision at the moment. I mean, we're usually in alignment, and I love this collaboration, what we're doing, and I can also see where there might be a different perspective, and then, what does that look like? So I just would want to run it by our membership, but we could certainly do that. If CPO wants to continue in that direction, which again, I understand what you're saying.
And it probably, won't come too much to a head, because my hope is that they might be done with a lot of the work by then. But if not, then I think maybe that's the time to raise it once they transition to CCA.
I was just going to say that because obviously not everyone's transitioning at the same time. So
Yeah.
It could be all about the dates. in which people are moving and which committees they're on and how close. So I think I just don't want to officially speak on behalf of it until I've run it past them, but I think all of those dynamics kind of play into going forward with that. So I appreciate you bringing that up. Thanks, Kevin.
Thank you.
And I think like there's one county transitioning in July, and then I think the next one isn't till October, if I am recalling correctly, but Jake can correct me.
That's what I believe
Yeah,
to be
okay.
true too.
All right, that sounds
July,
good.
October, November, and January are the transitions.
Okay, that sounds great. Thank you. All right, any other discussion? All right, hearing none, we'll go ahead and take the vote if you're ready, Don. Thank you.
Okay, Julia Tella,
Yes.
Kim Britt,
Yes.
Molly Bruner,
Yes.
Becky Bales,
Yes.
Michelle Frisbee,
Yes.
Kevin Glass,
Aye.
Tracy Green,
Yes.
Scott Helverson,
Yes.
Nicholas Henderson,
Yes.
Jake McClellan,
Yes.
Kelly Mitchell,
Yes.
Becca Muscat,
Yes.
John Priam,
Yes.
Barb Weckman Brecky.
Aye.
Unanimous? Yes.
And with that, the motion passes. What I will say is Don has gone ahead and put or reached out to both groups and put a meeting on the agenda for June, anticipating that we'd hopefully be able to go forward. So what I'm going to ask Don to do is to make sure that all three delivery systems, so Kevin Glass for MacPo, Molly for MacAC, and me for DOC, has a list of the members of those groups so that we can identify, through our organizations, we can identify who the co-chair would be from that system. And then we'll be coming back, as these groups finish up these deliverables, likely we would go ahead and close them down and then, figure out next steps and what our needs are for groups moving forward, depending on where we're at in the development of policy and all that fun stuff. All right.
All right. Then the next agenda item on the list is to walk through updates, a report out on progress from subcommittees, and have discussions about those subgroups and where they're at. And I know Don has a collection of a lot of that information, so I will move this to Don.
Good morning. Just why is it showing that and not what I want? Sorry.
There you go.
Give me just a second here.
It's up now, Don.
Oh, did it go up? Oh, of
It did.
course. It's just a little bit behind.
Yeah. I would ask if anyone here is a member of one of these teams that we didn't get an update from as Don goes through, maybe you could jump in and let us know if there's some new information.
There we go. Okay. Looking at deliverable 1, the ISR policy has been approved by CSAC and DOC Legal. It was briefed to the DOC Exec Council on the 20th of May. Jake, is there any update as to what happened at that meeting?
Just very minor revisions with just a nomenclature adjustment that not substantive change at all to the orientation guide that was used, and another minor change to just the graphic that we used for the transition worksheet. So that should be all ready with policy. Our policy team, I think where does it fit within the policy? 206.040 was the policy assigned. I think there's some more behind the scenes in relation to like these policies that apply to all 3 delivery systems. I think Kelly, there's probably some decision making as to where that fits in relation to maybe its own policy section specifically. The policy was delivered the next day and trained at the ISR conference on May 21st. We provided several scenarios that highlighted that shift in our release planning, in the supervision process and our transition process. So we had some agencies provide video, written scenarios. I thought those went very well. Created great engagement with the ISR folks across the 7 systems we have. Yeah, and so our go live date is planned for June 16th with the policy. So we are ready to rock with moving forward with these changes. That gives us a little space. The reason why we kind of pushed it out is because there's some adjustments agencies need to do within their own CSTS from shifting from ISR phases to ISR supervision levels, intensity levels, as well as any other minor client contact plans, et cetera, that might need to be inputted within the system, as well as other folks that within their own internal policies and procedures, they need to plug in our policy, our documents into merge documents within CSTS. So we want to at least give some good time to think that good space to for people to do that. Oh, thank you. But overall, we had again really good feedback, really good engagement with folks. We specifically highlighted some things that we do encounter with ISR. With our lifers, we provided some scenarios in relation to those folks that are supervised release board approved that have been on GPS monitoring for nearly 2 years. So really wrapping our head around how long do we need to keep people on monitoring that transition from work release to into the community when they're already kind of in the community already. So kind of thinking about that, as well as the moving from phases where it's kind of time driven to more where individuals can reduce their supervision level, specifically through engagement with case planning, following the following rules and positive behaviors in the community, that we can move people down that continuum as we see that progress happening with those individuals, and the early transfer of supervised release to supervised release, formalizing that more in relation to a supervisory approval process that's just not automatic, and then also with how we're handing people off to another agent in providing a more robust interstate transfer documents with that. So overall, very well received, and we're ready to move forward next month with implementation.
I'll just add real quick what Jake mentioned about the policy numbering. So I added a link in the chat to where the DOC policy manual lives. And right now, the majority of those policies apply only to DOC. There's a few that touch the agencies that do supervised release along with us. So for the most part, it's just DOC. And I thought it was confusing to bury the policies that we're trying to create that apply system-wide into our normal structure. So I had asked the policy team if they could develop a new subpart where we could put all the policies that apply to community supervision across the board to everyone in one place, to make it a little bit easier for everyone to find those, so you don't have to dig around and figure out how does DOC think about this and where would they put it. So that's what Jake referred to, and they're gonna give a tiny little bit of thought to structure, and then I think that's the direction that we'll be moving.
Okay. Looking at the development of an IPV policy, The policy proposal for the IPV reunification guidance is on the agenda for the DVSC. Initial draft is anticipated to be ready for CSAC by the end of June. Develop a comprehensive outline for full set of supervision standards, received research, and working on documents from CSG. Materials are being reviewed for future actions. So before everyone left, I was able to get in touch with Sephra and Aaron, thank you. And I was able to get the majority of their stuff. I did also reach out and got some of the stuff from Risks and Needs. So we do have some of the work that they did, which is good, so we don't have to repeat it. So we'll just see what further follow-up will happen. There was no update for developing a proposed prioritization and timeline. And looking at deliverable 2, I do not see any updates that we received for that. From Risks and Needs, of course.
Well, I can provide one. There is one of those items is exploration of a pre-screener. And before CSG left, the Risk and Needs group had created a subcommittee to look more in depth at the pre-screener concept and where could we start with one and how could we approach it. Julie Rude from Hennepin County is sort of leading the charge on that one. And so that subcommittee has been meeting and they've talked through sort of using, I don't remember if we've had a lot of turnover on this group, so not everybody was here a year ago, but we had Oregon present to us about a year ago on their workload study, and they have a pre-screener that they built into that process, and you may remember seeing that or not, but that is open source public. So the pre-screener group actually started with that pre-screen that Oregon uses and sort of used that as a way to look at what potential elements might we want to look at for use in a pre-screener. So Julie is leading the charge and sort of scoping out what do we want a pre-screener to look like and be able to do. And that work has been continuing. So there is a little stream of the Risk Needs work group that's kept going.
Okay. Thank you, Kelly. Looking at deliverable number 3, assessment-driven collaboration and case planning. I did not get any updates for any of the items in there, unless anybody has an update. Not hearing anything. Moving on to deliverable 5. The committee met with, I think it's Christine Ciro, who provided an overview of her work and assessment tool agencies can use to evaluate gender, trauma, and cultural responses, policies, and procedures. Subcommittee is going to do a practice run utilizing the assessment tool to identify what we can learn that can serve as a way to guide us towards recommendations. And they are looking at a recommendation by June for hopefully a vote in July. And then Jake had me add a task in here to establish a baseline training for supervision probation staff on gender responsiveness. This baseline training was presented at the EBP advisory and questioned our current core EBP curriculums and incorporation of gender trauma culture focus through skill practices and trainings. Jake, did you have anything to add to that?
Well, I don't know if that needs to be added as a separate, because I think that'll probably form into a recommendation.
Okay.
Into our gender responsive cultural approach services
Okay.
and trauma informed. So yeah, I can give an update. Our work group met yesterday, and we walked through an exercise called the Gender Responsive Program Assessment. That was developed in concert with Stephanie Covington and company that develops essentially it kind of fit this program. Like it was some of the questions we had we couldn't answer, but it gave us an opportunity to really look at what are some really low-hanging fruits that we could look at that could help kind of help us set foundations for gender responsive, trauma informed, and culturally appropriate services across all three of our agencies. And so it kind of really provided some spotlights to some specific areas regarding theoretical foundation, mission, administrative and staffing, and program evaluation, specifically looking at when Don kind of talked about when I last met with the EBP advisories, like what do we see with our core, when we talk about our core 5 core EBP curriculums, when we look at how we're training that, we're looking at the skill practices and how we approach responsivity in there. Could we do more? Can we implement more in regard to gender, trauma, and culture? And I think the resounding was yes, that we need to review that and do a better job at how we can weave in responsivity into those specific skill practices that we provide brand new agents at the foundation, and as well as for like booster sessions. Another thing we're starting to recognize is just responsivity as a foundational training. What is it? And how do you work with it? How do you address it? So where does that fit in that continuum of trainings that we have in the 5 core trainings? Is where does responsivity fit? That's going to be most effective for people to kind of go, aha, this person, I recognize the trauma. Now, how do I work with the trauma? How do I even approach the trauma with somebody? Or recognizing that because we're misgendered, because you're male, I'm female, vice versa, recognizing that there might be whether conflict is the right word, but that who maybe better fits, and that might be more administratively. How do we recognize those things in from our how we're bringing people into this work, specifically how we interview them, the type of interview questions, how are we identifying specifically that hiring process. I think another piece to this is I think Council State Government a few years ago provided like, hey, we need to hire a more diverse workforce. I think that's ubiquitous across all of our agencies in understanding that we need to hire a more diverse workforce that matches the demographics within your county. Another piece is initial ongoing ethics and boundaries training. That specifically fits very closely with gender, trauma, and culturally appropriate services. Is how are we providing ethics and boundaries training across our hiring practice? Is that something that should be done just done initially, or is that an annual training? We're trying to be very cognizant of the fact that when we approve 16 hours of the EBP, that we're not trying to just dump trainings in versus how, with the current trainings we are having and doing, how can we weave in a more of that culture, trauma, and gender into what we're currently doing? So how can we modify what was already asked of us versus keep adding more training and training and training? And can we put it more into skill practice and be more intentional with how we're training ongoing? The other piece too is we identified is about including those voices to the table. We know with the 401 statute and advisory boards, it includes people, including people from a diverse background on your advisory boards. Maybe look at how do we expand upon that, just from an ongoing perspective, as how are we engaging with our community and bringing in those voices ongoing to help, that helps us strategize around developing resources, developing supervision strategies, etc. And working with gender, trauma, and culture. So that's kind of that assessment kind of really helped us hone in a little bit about what is that foundation we need to build in regards to gender, trauma, and culture.
Thank you. Moving ahead to deliverable number 6, there were no updates and no updates for number 7. Deliverable number 8, policy development is anticipated to be very close, if not completed and
Oh,
ready
can
for
we-
presentation.
Can we go back to 7?
Yeah, I'm sorry. Sorry, I
Sorry.
jumped way too quickly.
No, it's totally fine. Like, it took me a second to realize what was 7, what was not. So, this one is grayed out because it's really like DOC's job to get this done. This was there's a report in statute, an annual report that is required to be produced and provided to the legislature on different outcomes related to community supervision. This past session, the timing of that report was changed from January to May. We've already blown past May. We have not done the report this year, but there's a very good reason for that. So I just want to, and it's an exciting reason. So I wanted to tell you what's going on. So last year, if you recall, we looked at all of the different elements of data in the statute to try to figure out, do we have that information? Is it information that we have to collect, anew? And the one area where DOC didn't have the data for all of the state was in probation violations. And so we had kicked off a project to try to get that data to be passed up to DOC so that we could begin reporting on it. At the same time, the CSTS exec team, I think, was leading the charge, or somebody over at CSTS was leading the charge on creating a new data structure. And it's technical, so I don't understand it. But the vendor was basically going to try to pool the data together to provide for greater reporting options for all of the corrections agencies. And they had asked DOC if we could provide the server space to allow them to pool that data, I think, into a data lake. And that sort of fit with our long-term vision of wanting to get more data from CSTS anyway. So we went back and forth with the vendors, our IT folks and the vendor for CSTS went back and forth. And we have just, as of this week, approved the server space for the vendor to create that data lake. So we are going to delay reporting until that step can happen. And then we're going to connect with that new location for the data instead of trying to, we have this very old antiquated way of getting data and it's broken and it's not sustainable. So we don't want to put any money into that. So we're going to allow that process to happen, create the server space for it. It'll be cloud-based, so it'll be more flexible and in the more modern architecture. And then we'll connect over to that and we will use that to create the reporting. In the meantime, DOC does put out some regular reports that address some of the legislature's requests. We do the probation survey, which gives those population numbers that the legislature was looking for. And we also do a recidivism survey or recidivism report that shows 3-year recidivism rates for people who successfully complete probation. That's not everything the legislature asked for, but it's one piece of it. So we'll make sure that they see those reports in the meantime. I'm sure it will take until next year, till all of this is up and running. But I think it's a really exciting development. And I just wanted to give everybody that update.
Thanks, Kelly.
Thank you, Kelly.
We back up to, I think I have an update on the deliverable 6.
Oh.
If you scroll up.
Waiting for it to
John.
catch up.
We're on a delay here, so.
Wow. That's really
wow,
delayed.
this is really.
Well, it's on the behavior response grid. I do know that the JRI group had created a subgroup. They met recently. I guess I don't know the exact day. I have a staff on there. And they were also looking at a bunch of research and the Ramsey or Scott, there's a lot of different grids out there. And so what was the foundational research that really informed these particular behavior response grids? to really be the platform or the guiding principles for developing a statewide behavior response grid. So that work is continuing to go on that way. And again, I just want to say I appreciate the subgroup around, Jake, when you did your update around the responsivity, risk need responsivity. We've done, I think, a good job on the risk need over the years. And the responsivity is, if not the same importance, maybe more so coming out of research now. And so all of the elements that your group is talking about is critical, and how it's not standalone. It's really embedded into everything that we do. And so I think about even the response grid and how, how does that, the work that you're doing or that group doing, eventually even integrate into our response grid, because so much is context and so much is about the person, the whole person, and what's going on with them, on how any of these things that we're working on apply. So again, just kind of wanted to say, thanks to all the groups, but that's an important piece that I think you're drawing out from that one. So
Thank you.
yeah.
There we go. Moving on to number 8. Oops. The policy development is anticipated to be ready for presentation at the July CSAC meeting for developing a policy to require all agencies to ensure training, coaching, and quality assurance of the 5 EBP skill areas. And looking at the other policy, develop a policy to require all agencies to ensure applicable staff complete initial training within the first year. That policy is looking to be ready for presentation at the July meeting. Looking at challenges, was the intent of this policy for supervisors or directors to complete the required training as well?
I can speak on that.
Okay.
Go ahead, Kevin.
So there's the second part of that is the 16 hours of the annual training. So in the recommendations from our group and then from the commissioner's response, it didn't discuss or talk about who that applies, if supervisors, directors are included in all staff. So the question from our group is, should supervisors, directors, all the way to commissioner of corrections, like where do you end the 16 hours of annual training for all staff? So looking for feedback from the group.
We can open it up for discussion then. One of the things that I know I've been in subgroups talking about is we all need training, we all need development, we all need to understand what's going on any of these particular aspects. I know I do. And so I think there is a level of it. Is it the exact same, dosage and technical expertise that is needed? Probably not. But I think that that's the conversation we'd love to have here for those that want to weigh in on this topic.
Becca, this is where you come in with your bit of wisdom that nobody thought of before. So if you have any ideas.
Well, I do love the idea of every single person all the way up to the commissioner having to do 16 hours of training. I really do. I actually love that. Yeah, I don't think, unless you want to develop secondary tracks that are more higher level and separate out, the fundamentals, but for ongoing trainings, I just think, yeah, that should apply to everyone, supervisors included. They should all be kept up to date.
Thank you.
This is Becky Bales here. I agree. I think that it's also the way we do training now. So much training can be done in different formats. So I think that makes it more accessible. I think most counties require quite a bit of training already. And so I don't think that's a big change, but maybe I'm looking around the room here if I'm off on that.
I would say that we do. I think that if I'm understanding the very particular question, Kevin, correct me if I'm wrong, is, this is 16 hours of EBP really, I think, intended to be skill development around the major categories of our evidence-based practices. So you have your assessments, your case planning, et cetera. Different than just 16 hours of training, right? Because there's leadership trainings, there's implementation science trainings, there's all sorts of things that are good for all of us. So I guess that's my opinion. So is it just 16 hours? Is it really around like these particular large groups that all these deliverables are focused on? I think it's what are we doing here when it gets above the line staff, people working directly with clients level of expectation here?
Yeah, and I think it kind of depends on the role that the supervisor it takes. So like the bigger the organization, so I picture Hennepin, and I can't imagine the director in Hennepin like ever having a client to serve directly, but they do need to know what risk, needs, and responsivity is, and what their, roughly what their agents are doing, so that they can continue to advocate for the funding and resources that need to be provided to ensure that their agents are at the best of their profession, right? So I think there's like a difference. Whereas, and then I know here at DOC, our district supervisors are expected to be leading coaching circles. So they need like pretty detailed training to be able to, listen to someone's tape and provide feedback on how to, like what was good about it, what could be done better, and to lead a discussion about that level of skill building. So, the way that the deliverable is worded is ensure applicable staff have this. And I do think that there could be different expectations by role. In a smaller county, the director might actually, directors have had caseloads. They got to be all the way trained up on everything to do that and run the agency. And then just like I said, the opposite would be Hennepin, where it's more about like understanding what's expected. So it depends, I guess, is my answer. I don't know.
I see Jake, you put setting minimum standards would identify those providing direct services to clients. Yeah. I'm wondering, as I'm listening here, if it's, and looking at the language in the request here on deliverable 8, is it more, again, high level guidance around in our comp plans, or in like, we need to be able to like explain what our current system is and how we are meeting the needs at our certain levels. So what supervisors are doing, et cetera, as it pertains to all of this, because I think it's wholly appropriate. Like you just said, if I have a caseload, I need it all from that level, and maybe not in some others, but I need something. So we just keep it general enough that we can speak to it maybe. So maybe the guidance is more, for sure, if you have direct client, like you're doing case management, this is what you need. And it's not about the title that you hold, it's about the work that you're doing. And then as it moves up, depending on the organization, it's, again, at some level, even at the commissioner down, you need a high level of understanding of our EBP practices for everything Kelly just said.
Yeah.
And then you have to differentiate in your own jurisdiction what your org chart basically looks like, and then how you're meeting all of these needs, I guess. Just my thought.
Does that answer your question, Kevin?
Yeah, I mean, it's good feedback to have that I'll bring back to the group. And we'll more discussion and obviously bring it back to this group as well. So thank you.
Yeah, thank you for raising the question.
Was there any update in seeking legislative amendment to change the statutory language? The last part of deliverable 8. I don't think I saw anything.
That one's not jumping out at me as the other, like the members changed.
What's the last part of
Well,
deliverable 8?
What was that?
What were you just asking about? Which
Seek legislative amendment to change statutory language to advised by EBT statewide advisory committee and revise this CSAC charter.
Oh, that raises a really good question. That language did not go through, but the, we're going to call it whatever we want to call it. So I think that'll be fine. But it does remind me, there were a couple of legislative amendments that did go through that CSAC had asked for. So we will, that bill was just signed on Friday. So we will get that language pulled together and provided to CSAC. But the biggest one being that the legislature authorized adding members from the judiciary, prosecution, and defense. So we will have new membership to fill.
Thank you. Oh, and that is in deliverable 11A. It's
That's
coming up.
11A.
So, and I did not receive any other updates for any of the other deliverables, 10, 11A or 11B, but we did get an update on 11A that will be further highlighted next month.
Yeah, I think that one's on me with the workload study. I think I recognize I didn't have a fancy sheet to complete for that one, but
sorry, I'll take
when you're ready. When you're ready, I'm ready.
Go for it, Jake.
So it was signed yesterday for the workload study. So we have the signed contract is with our Department of Admin. They have to log it in. We'll receive a copy, and then we're able to move forward with getting our leadership team together and starting our workload study process. As a reminder, our leadership team comprises of, for DOC, Carter Deers, myself, CCA, Molly Bruner, and Corey Mavis Rowe. For CPO, Steve King and Mike McMillan. And then we also have Julia Tella, Danette Buskovic, and Matt Cook as representatives from research as well as AMC. So that will be our leadership team. They have been emailed just saying, hey, be ready. I think the first step, if we can get information out to our MACAC and MACBO partners about the data sharing agreements. I think we can get ahead of that. And if we can have conversations with our directors to let them know those will be coming in very soon once we get our meeting together, so we can move forward as quickly as possible with getting those signed and back to our vendor. And then we should be able to hopefully try to get our first phase done before July 1st, if we can get those done and back and moving forward with that first phase of the process.
Thank you, Jake. And with that, I believe that is all the updates that we have for our deliverables. Pending any questions.
Seeing no questions, then we have other business. We mentioned it with the vacancies. We have the ones that would come up July 1st, but then I believe there's still at least one other one, but you
We
go ahead,
do
Don.
have one other one. Brandon Elcurie did resign. I am working with Wendy Spry, who is the tribal liaison here at the DOC, to get a MIAC representative to be appointed.
Wonderful.
So I'll have more information next month.
Okay, thank you, Don. And with that, we have I think this is a second or third maybe meeting that we've done this, but leaving room for any public comment. So I believe whether you're in the room or online, if you're online, what is the best way to
Just have them excuse me. If you're online, just raise your hand. I can actually see you. And actually, we don't have any attendees online anymore. So.
Oh, all right. Well, then is there any public comment?
Just go into the
You sure
microphone.
can. Yeah.
Here you go.
Oh.
I'll give you that one.
Will Cooley, Minnesota Justice Research Center. Just want to thank Jake for inviting me to the ISR conference last week. Learned a ton, got to meet lots of folks. That's it. Just thanks, Jake.
Thank you. All right.
Is there any other business by other members of the committee that that anyone would like to raise today, or topics that we didn't cover that you have questions about, or anything like that?
All right. All right. Well, then, once again, thank you everyone for your commitment to this group and the conversation. The next meeting will be June 25th. And yeah, I think we'll just be continuing to get updates. If there's policies that come in, we'll be reviewing those, and just keep moving this work along. So appreciate all of you. We do not need a motion to adjourn, right?
You just have to say it.
I would officially adjourn this meeting. I don't normally do all the Robert's rules, so I continue to apologize for my, I read them once. It's quite dense. So so there you go. So have a wonderful day.
Thank you all.
Everyone.